HER2-positive gastric cancer is a very specific biological subgroup in the gastric cancer, and most of the data is based on the first-line study. And after the first line, we know that about 70% of patients still have HER2 positivity, but currently the standard of care is Paclitaxel and Ramucirumab, and we didn't have prospective data showing the continuous of HER2 targeting in that second-line population. So we designed the study of Paclitaxel and Ramucirumab as a standard of care, and on top of that, we added Trastuzumab to inhibit the HER2 residual clones. So that is the study design of HERAM trial. So in the phase 1 study, we figure out the full dose of Paclitaxel, Ramucirumab, Trastuzumab combination is safe and tolerable. So we expanded that dose for evaluating the efficacy. So in the phase 2 study, we have 50 patients, and the efficacy is very significant. And median PFS is over 7 months, and overall survival is 13.6 months. So this is a very improved survival, even in it's a phase 2 study with smaller number of the patients. Because in the second line, most of the studies did not have longer survival over 7 to 8 months. So I think this regimen is very good for the second line as a potential improved survival. This update has been included biomarker updates. So we checked in the 23 patients with a concordant HER2 expression before the treatment and after the treatment. And we can see after first-line treatment, about 35% of patients lost HER2, meaning that about 70% of patients still have HER2 remaining in the tissues. In that, that's the rationale that we need to continue to control that HER2 positive clone with adding Trastuzumab. However, the tumor response and survival, according to HER2 expression, did not related. So it's not just HER2 expression. Also, the combining with chemotherapy is very important. So adding Trastuzumab to Ramucirumab and Paclitaxel in the HER2 positive setting is showing the potential benefit with improved survival. And the currently biomarker is only HER2, but I expect more and more new biomarker will come up to select the proper patients in this subgroup of the patients.